Most people who get COVID recover a few weeks later, but some continue to experience symptoms weeks and sometimes months after their initial recovery. These patients suffer from what is known as long COVID. And Dr. Adam Brown is an emergency room physician and chair of the COVID-19 National Task Force for Envision Healthcare, and he joins us from Washington, D.C. And Dr. Brown, you know, we're now starting to look in the rearview mirror at some of COVID, but some people are still suffering from the symptoms. How long can they suffer from long COVID?
We're still trying to determine that. Long COVID is defined as someone having symptoms well over the normal course of the disease. So over a month, 2, 3 months, people still having some symptoms. But Del, what's really interesting about it is that there's no one symptom associated with long COVID. There's a constellation of symptoms, everything from fatigue, muscle aches, even psychiatric illness worsening, or new depression, anxiety. But there's some new evidence that has come out over the past 2 days showing that there's a significant increased risk of cardiovascular disease, blood clotting, heart failure, heart attacks associated with long COVID, even mild symptoms of COVID if they had when they had them originally. So we're still learning a lot about this, but I'm worried about the impact that it's going to have on our healthcare system.
Dr. Brown, this is what's interesting about this is there is a large swath of the public that believes I'm going to get it. It's just like the flu. And I've heard so many people say that over and over again. In your medical experience, was there ever a flu that left behind so many long haul symptoms such as brain fog, loss of smell being permanent, muscle fatigue, all the things that you just described?
Absolutely not. I mean, to be clear, flu is deadly, but the percentages of death associated with flu is very, very small. There are some cases, of course, of other viruses causing long-term symptoms. Take shingles, for example, a chickenpox virus that people got when they were young and then later on have symptoms. So there are other viruses that do cause reactivation or longer symptoms. But we've not seen a virus that's a respiratory type of virus like this that causes such an odd constellation of symptoms ranging from severe cases with cardiovascular effects versus even some more mild, and even I say that it's mild, but they can be debilitating, fatigue, brain fog, and even mental health disease. So clearly COVID is not mild. And to your earlier point, I am encouraging people to do everything in their power to not get this disease. It is not a great disease to have. So getting vaccinated and boosted is the way to prevent that.
Who is at risk? Who's most at risk for long COVID?
Sure. So just a few weeks ago, a study came out to kind of look at who is at risk of long haul COVID, and so they found that patients with diabetes, autoimmune disease, can be some of the risk factors associated with it. But we're still learning a lot because there's also some studies that have indicated that high viral load at the beginning of an infection and even prior viruses that some people may have within their body may expose them to risk for long COVID. But we're just learning about it. I try to remind people that this disease has only been around for 2 years, meaning COVID-19. And sometimes the effects of long COVID or residual effects from COVID may take months to see. And as we all have just been living through, Omicron just visited us around the Thanksgiving time period. So we don't really know what the effects of Omicron are going to be from a long-term perspective. So the point here is we're starting to see some signs and some symptoms of what may be the reasons why people may get long COVID, but we don't know fully yet, and a lot more work needs to be done.
Dr. Brown, one last question, 30 seconds before we go. 5 states now dropping their mask mandates. They're doing so by the end of the month, by the end of next month, but is now the time that we start to ease up on masks?
I'm telling you, it gives me anxiety when I'm hearing a bit about states starting to drop these mask mandates. I like to remind people that we're still in the Omicron wave. And even though we've come over the crest, and we're starting to head down, we still have cases that are higher than we had them just before Thanksgiving. There is a time and place to remove masks. I just think we need to wait a little bit longer and ensure that we have triggers and data to support when community spread is low enough that we can take away mask mandates. That said, you don't need a mandate to still wear a mask. So still wear those masks in areas where you don't know who's vaccinated, and of course, where there's a large number of people that are gathered.
I'm wearing them because of my granddaughter's colds, to tell you the truth. Those little
Same.
kids are petri dishes, but that's a story for a different day. Dr. Adam Brown is an emergency physician and chair of the COVID National Task Force for Envision Healthcare. Dr. Brown, thanks for being with us today.